Okay, so we're going to talk now about some of the physiologic changes in labor that happen to the maternal body. In labor, cardiac output increases. It peaks about 10 or 20 minutes after birth, and then it gets back to pre-labor baseline within that first hour, and the maternal heart rate decreases at that time. So healthy people can actually tolerate all of those changes, but someone with cardiovascular disease may struggle with those. Blood pressure increases during contractions, but it goes back to baseline between, clearly because of pain. And also sometimes that contraction causes a muscle contraction, which is going to alter the blood pressure reading more than it alters the actual blood pressure. So to get good blood pressures, you want to have blood pressure in between contractions. Vena cava syndrome we've talked about. The vena cava goes up, basically up the center of, in the posterior, of the center of the back, basically. So if we have the weight of the uterus and the fetus on the vena cava, it prevents blood from coming back up from the legs. And so blood goes down, but it can't come back up. And so we end up with too much blood pooled in the legs, not enough blood to maintain blood pressure up top. And so we can have, the mom can feel weak, dizzy, short of breath because we're not getting enough blood circulating. But also, if we don't have enough blood from the waist up, that's going to include the uterus. We're not perfusing the uterus enough, then there's not going to be enough oxygenated blood in that pool for the placenta to be able to exchange gas as well. So we can see changes on the fetal heart rate just because the mother is lying supine. So we always want to have someone in labor tilted at least a little bit to the left, preferably left. We can move around different positions, but we want them off the back. Left is preferred for a lot of the time. If the patient valsalvas, that decreases venous return and slows the pulse, and it can also decrease placental perfusion. So when they're pushing, if they hold their breath, push as hard as you can, they're going to valsalva. A lot of times the fetus handles that okay. We may see some dip in the heart rate, but it comes back up. But if we have a fetus that's barely tolerating labor, and then we add that valsalva on top of it, it can actually drop them pretty significantly. So we want to encourage more natural pushing. The hold your breath, push as hard as you can is not usually the best option for delivery. In labor, the white blood cell count may increase. We need more oxygen in labor, so increased oxygen consumption. But because of the pain and all the other sensations that are going on and anxiety, hyperventilation is pretty common. So it's not uncommon for women in labor to hyperventilate. Voiding can be difficult in labor. So they may have a hard time actually emptying the bladder because the pressure of the fetus can compress the urethra. There are, they may be embarrassed to go, especially if they can't get up and go anymore, not want to use a bedpan. They may have decreased sensation and might not be able to feel that the bladder is full. Sometimes the muscle tension from pain makes it harder to empty the bladder. There are meds that actually may cause urinary retention. And if they get an epidural, usually that causes urinary retention. But if the bladder stays full in labor, it can impede the descent of the baby. If the baby's pushing down against a full bladder, even if it doesn't make the descent more difficult, it actually is going to cause more pain in the bladder, and it can cause more damage. So we want to make sure that we're helping that patient empty their bladder frequently. The perineum and the vaginal tissues get more flexible and they distend for birth. In labor, the muscle activity is very intense and the joints get really lax. So joint injuries can happen because of poor positioning and not enough support for joints. Endorphins raise the pain threshold and produce some sedation. And then the pressure of the presenting part makes the perineum a little bit numb at times. GI motility and absorption decrease. So in early labor, they may be hungry, but later in labor, loss of appetite, nausea, and even vomiting are common. It's so common, in fact, that women vomit when they're In more rapidly progressing labor, that we joke that puking means progress. And if someone vomits in labor, one of the first things that you do is check and see if they've progressed and if they're near delivery. Diarrhea can occur in early labor because of the prostaglandins. Metabolism increases. We're burning so many more calories. It's really hard physical work. And because of that, blood glucose may decrease. So those are some of the physiologic changes of labor for the person who's delivering. Now, in the next section, we're going to talk about care in labor and delivery.